Welcome, future phlebotomy professionals. If you're gearing up for your certification exam, you are in exactly the right place. We're going to break down all the critical knowledge you need, not just to ace your test, but to really shine in your career from day one. Let's get right into it.
That's really the truth, isn't it? Every single sample you collect is the very first piece of a patient's diagnostic puzzle. The accuracy of every test, every diagnosis, every single treatment plan, it all starts with you. So mastering the details isn't just about good technique, it's about understanding your vital role in the entire patient care journey.
So here's our game plan. We're going to walk through 5 key areas that are absolutely essential for your exam. We'll start big picture with the hospital, then we'll talk money, pop into your home base in the lab, master that all-important pre-analytical phase, and finally, we'll follow a specimen on its journey. Think of this as your roadmap to success. Okay, let's dive into our first section. To be a great phlebotomist, you've got to understand the world you're working in. Knowing how different hospital departments tick and how they all connect, well, it's not just trivia. It has a real impact on how fast you can work, specimen turnaround times, and most importantly, patient safety. When you look at all these departments, you can see how everything's connected, and you're going to be interacting with pretty much all of them. Now for your exam, you'll really want to pay close attention to the ICU for your critically ill patients, the emergency department for those stat collections, radiology, they might need labs before certain scans, and pharmacy, which totally relies on your results for medication dosing. You're kind of the link between them all. All right, let's switch gears a bit and talk about something you might not think about every day, how healthcare actually gets paid. Now, you might not be handling the bills yourself, but your work is absolutely critical to the hospital's finances. Every single thing you do, from checking a patient's ID to labeling a tube just right, can decide whether the hospital gets paid for its services.
So in the US, the money mostly comes from these 4 types of payers. You've got the government, commercial insurance, managed care, and some employers who pay directly. But you know what they all have in common? They will not pay for services if the paperwork and the specimen collection aren't perfect. Your precision is what stops a claim from getting denied right at the start. Oh yeah, this is a classic exam question, the difference between HMOs and PPOs. Here's the bottom line for you. For an HMO patient, you have to make sure the collection is happening at an approved in-network lab. With a PPO, there's a little more wiggle room, but it still affects what the patient pays. A simple mistake here, like drawing blood at a non-approved location for that HMO patient, pretty much guarantees a denied claim.
Now let's talk about the actual language of billing, starting with ICD codes. Just think of the ICD code as the Y. It's the diagnosis code, for anemia or diabetes that tells the insurance company why a certain lab test was needed. If there's no matching ICD code, that's a huge red flag for them. So if ICD is the why, then CPT is the what. This code tells the payer exactly what you did, and you'll definitely want to memorize CPT code 36415 for a routine venipuncture and 36416 for a capillary collection. Trust me, they show up on the test all the time. Your perfect draw is what proves this billable service was done right. And last but not least, for patients staying in the hospital, we have DRGs. This is basically the bundle. The hospital gets one fixed payment for a patient's whole stay, and it's all based on their diagnosis. Your lab results, like a positive blood culture that confirms sepsis, can change the DRG and change how much the hospital gets paid. It really shows how your work connects to the big financial picture.
And here's the bottom line, and it's a huge exam alert. It is your responsibility to check that the requisition is complete and it makes sense. If you draw a sample for a test that isn't justified by a diagnosis code, you're not just risking a denied claim, you're creating a major compliance problem. Your attention to detail protects everyone, the patient, the hospital, and you.
Okay, let's head over to your home base, the clinical laboratory. This place is the diagnostic heart of the hospital, where all those specimens you so carefully collected get turned into life-saving information. Let's meet the team. So the lab has a pretty clear structure. At the top, you have the director, who's usually a pathologist. Then you have the MLSs and MLTs, the amazing techs who run all the tests. But look at your role. You control the pre-analytical phase. That's everything that happens before the sample ever hits an analyzer. And this is huge because that's where the vast majority of lab errors happen. It all starts with you. Which brings us to what is, without a doubt, the most important section for your exam and for your career. The pre-analytical phase is your world. Mastering these procedures isn't just a good idea, it is absolutely non-negotiable for patient safety and accurate results. Let's get into the nitty-gritty. The venous order of draw. You need to burn this into your brain. Seriously, this is not a suggestion. It is a strict rule designed to stop the additives from one tube from messing up the sample in the next tube. You always start with sterile blood cultures, then you go to light blue for coagulation, then your serum tubes, then green, lavender, and finally, gray. Every single time.
But wait, the second we switch to capillary collections, like a finger stick, the order changes. So why the difference? It's simple. You're working with a tiny amount of blood that can start to clot almost immediately. So after blood gases, you grab that EDTA lavender tube first. This makes sure you get a good sample for your blood counts before any tiny clots can form. This is a super common trip up on exams, so lock in the difference. Venous versus capillary.
And here is exactly why we are so obsessed with the order of draw. If even a tiny, microscopic drop of EDTA from a lavender top gets into a green top for chemistries, the results will be completely dangerously wrong. The EDTA will make the calcium look critically low, and since it has potassium in it, it will make the potassium look critically high. That one little error can lead a doctor to make a huge medical mistake.
Okay, so you've done it. You've collected the specimen perfectly. You nailed the order of draw. What happens next? Let's follow your sample as it makes its way through the different departments in the lab.
First stop could be the coagulation department. This is where we look at the body's ability to form and dissolve blood clots. It's super important for patients on blood thinners or for figuring out bleeding disorders. For coagulation tests like the PT/INR, you're grabbing a light blue top tube. And the number one most critical rule for this tube is the fill volume. It has a very precise amount of anticoagulant inside, and it needs a strict 9-to-1 ratio of blood to that additive. If you underfill this tube, even by a little bit, the ratio is wrong, the results are worthless, and the lab will reject it. No questions asked. All right, next up, hematology. This department is all about the cells floating around in the blood, your red cells, white cells, and platelets. This is where we look for things like anemia, infections, or even leukemia. The big test here is the complete blood count, or CBC, and that's collected in a lavender top tube. The absolute most important rule for this tube is what you do the second you finish the draw. You have to immediately but gently invert it 8 to 10 times. Don't shake it, just a gentle rocking motion. This makes sure the anticoagulant mixes in and prevents tiny microclots that would totally throw off the cell counts. And finally, let's talk about the most critical collection of all, blood cultures for the microbiology department. The name of the game here is sterility, 100%. You always draw these first. The skin prep is a strict 2-step process. First alcohol, then an antiseptic like chlorhexidine. Now this next part is vital. You must let it air dry completely. Don't blow on it, don't fan it. That just recontaminates the site. The antiseptic needs that time to work. And once it's clean, do not touch it again. A contaminated blood culture is a huge problem. So as you get ready for your exam and as you start your career, never, ever forget this. Your job isn't just routine, it is foundational. From understanding the hospital, to the billing codes, to the order of draw, every single detail matters. The precision you bring to your work directly defines the quality of care that patient receives. It's a massive responsibility, and by mastering these details, you are more than ready to meet it.